Grief Talk with Vonne Solis, The Clips. I felt very close to you when I first met you. Dawn and I met over an online business course, actually. And you can always sort of tell, you can feel like when you're feeling left out, and this, my audience, please listen, when you're feeling isolated and left out, whether it is as a visible minority, whether it is something that you're living with that other people can't see, a mental health issue, grief certainly causes a lot of those types of things. I myself, I will be honest, live with post-traumatic stress disorder. I have been living with it now for 17 years since my daughter's death. People can't see it. When you look great and there's expectations for you to act a certain way, it's a lot of pressure. So everything that you've just talked about, Dawn, obviously briefly encapsulated, it isn't too different from living with limitations, living with a disorder, living with such an unbearable loss. And you and I immediately, I think, connected when I found out you had a bereaved mom. And I'm like, oh. And then as a sibling, I'm like, oh, wow. Like, what was that like for you? And so basically, I wanted to kind of relate your frustrations that you talk about in terms of the hardships. You don't feel heard, always feeling like you have to prove yourself, the fatigue, the loss of identity, really, really important things. You can relate those to, your struggle in moving up professionally, but I can guarantee you all of those things have hit me as a bereaved parent for sure. And I think proving yourself is one of the biggest things that we are faced with having to do as a healthcare professional first. And understanding these struggles, I'm talking in the general healthcare system. I know some of your work involves wanting minorities, visible minorities, and perhaps others not to be afraid to seek healthcare support. And when we don't feel understood, we stay away from doctors. It's pretty right. We stay away from therapists, or we get mad at them and so on. So living from both sides of the fence, what would you offer to anyone listening to this podcast or watching this podcast? What sort of advice, based on your own wisdom, your personal experience, your professional experience, what can they do to try and get support, to find the tools if they need them from a medical professional, help medical professionals really understand what they're going through, because in a lot of cases, people won't reach out for help because they don't know what they're going through. If you want to speak to any of that in your professional, personal capacity, it'd be awesome.
Okay. So first of all, I would say that there's some responsibility from healthcare providers to have some empathy with what service users are going through. I have a philosophy that if you have to touch healthcare services, that's a crisis, regardless of, how major or minor that will be. Actually going to hospital, going to see a doctor, to access any healthcare services is a pretty big thing, a thing that causes great anxiety and, thoughts about mortality, all sorts of things. I was for a children's nurse for the majority of my career, although I'm trained as an adult nurse as well. And we had a philosophy of, holistic care, looking at the whole family. So not just looking at illness in a reductionist way, in sort of like a disease, but looking at how that impacts on the family. And that helped. That philosophy definitely helped, and is sometimes it's something that's missing. So I'd say, first of all, I want to say that healthcare providers and the medical profession have some responsibility around that. So it's not all on the service users. I think for me, and the way that I help people, particularly now I'm out of the health service, one of the things I can do is when you're going through a crisis or you are impacting on health services are impacting on you and your life or your family, it's really important that you don't necessarily take that responsibility on, that you need someone to help you to do that. Because if you're ill, even if you're having a baby, I remember when I had my daughter, my son, my first child, I was quite shocked at how little control I was in, and I needed an advocate to be the person that advocated for me, and I just needed to concentrate on having the baby. So I think it's important to get support, so to get someone to listen to the conversations that you might not be able to process at that time, to write things down if you can, or get someone else to write them down, and also to go prepared. I think, unless it's an emergency situation where that's not possible, but if possible, to read up as much about whatever you're going in for as possible, write things down, because you will forget, because it's a high stress situation. And then go have someone go with you if possible, if you want to, depending on how private it is, but then being really clear. So I know there's been a lot of training, and I've seen it actually in action for my own personal health issues, that doctors and nurses sort of like, it's really important to check understanding when people access healthcare, because it's a lot of information, and it's a lot of information for me, and I'm a healthcare person. So it's really important that you understand what's happening, the implications of what's happening, how that's going to fit into your life. But I would also say, think about, what health means for you, what's important to you, what healthy is for you, because that's going to affect how you manage your health and your well-being, and whether that's in crisis or just generally. Healthcare shouldn't be about just crisis. It should be about, how you manage your health from birth to death, actually. And I think that's really, really important. So we should be having conversation with children, with young people around their health, throughout the life course, and that's sort of like a public health model.